On today's SNHU Explains, we talk to Sandy Finley. She's a clinical faculty and course coordinator for the undergraduate nursing program here at Southern New Hampshire University. We talk about the benefit to earning a nursing degree online and why SNHU's program is so unique. So stay tuned. So to start off, I'm going to start really simple. Can you please just tell us your name and your role here at Southern New Hampshire University?
I am Sandy Finley, a clinical faculty and course coordinator for the undergraduate nursing program.
Your professional title has three acronyms in it. It's DNP, RN, CNE. Can you just tell me what those stand for?
Yes. So first and foremost, I am a registered nurse. So that's going to be the RN in my credentials. I have obtained my doctorate in nursing practice with a focus on nursing education. So that's going to be that DNP at the very start of it. And I'm also a certified nurse educator. So that's the CNE at the very end. And that CNE is obtained through the National League for Nursing. I also have my master's degree, but that's not included in all of those.
That's great. So what initially led you to become a nurse?
So there's not a specific moment. I know a lot of people can say that, they took care of somebody or they had a lot of healthcare issues, and that wasn't the case with me. I just knew I wanted to be a nurse, and I began saying it at a very young age, just, I'm going to be a nurse. I'm going to be a nurse. And that's what happened.
So what keeps you engaged in this profession?
So my engagement comes from the ability to continually grow in nursing just by being active and involved in the profession. So I can walk away from interactions that I have on a daily basis, having learned something or grown as a nurse. I actually just made the joke yesterday that having my degree or having years of experience in nursing doesn't stop me from asking questions. I also love the fact that in nursing, I can pursue any specialty or area that interests me.
Yeah, that's great. Yeah, my wife says a similar thing. Like every day is so much different from the day before that.
Absolutely.
And you are constantly learning something new, which is really exciting.
Yes.
So can you tell me a bit about the education and professional journey that took you to where you are today?
It's a little long because I've been in nursing for 21 years now, so bear with me.
Yeah, please.
But I'm very proud to say that my pre-licensure nursing program was actually a hospital-run diploma program. So what that means is that I graduated from nursing school without a degree. So I didn't have an ADN or a BSN, but I had met the criteria to pass the national licensure exam to become an RN. So I immediately began working on a med-surg floor, and it was there that I realized I love teaching. And so as I realized that, I was like, okay, I'm going to find an RN to MSN education program. And so that's what I did. And so while I was working on my MSN, I went ahead and transitioned to the emergency department until I graduated with my MSN in education. So because I now had a degree in education, I started teaching as a nursing educator at the same pre-licensure school that I had graduated from. So I was staying within that area that I had kind of grown in. And then, although I love teaching clinicals with my students, I knew I wanted to ultimately be in online education. So that led me to pursuing a position as an adjunct instructor here at SNHU. And so I began working as an adjunct at SNHU while also being a clinical educator at that pre-licensure program. And then, lucky me, there was a full-time position that opened up at SNHU. So I was obviously able to get that position. And at the same time, I knew that if I wanted to continue to grow with online teaching, I needed to get a terminal degree. So I started my journey of getting my DNP while also starting here at SNHU as a full-time clinical faculty member. And through that, because I was online, I was like, I don't want to lose my skills. Everybody always says that I don't want to lose my skills at the bedside. So I maintained a position in PACU as a nurse, which I actually still a PACU nurse. And I've graduated with my DNP now. I love my full-time position here, and I am still a PACU nurse. So long journey that's still going.
Because my next question was going to be, can you tell me about your educational journey? But I believe you just did that, and
Yes.
answered that perfectly. So while you were doing all that, you were working and going to school at the same time,
Oh,
correct?
absolutely. Yes.
And what was it like to have that balance of both?
Um, Hard, obviously. But I have to say that my educational journey, it's all been online, other than my pre-licensure program, of course. But my master's degree and my DNP was all online, which is probably the reason why I'm so passionate about teaching online. It's because that's how I grew as a nurse in my educational journey. And if it wasn't for online, I don't think I could have managed it. I was working night shifts, 12-hour shifts. I have 3 children within this span of time. So I literally started my MSN while I had a newborn. So I understand all of those challenges that go along with it. And if it wasn't for that ability to have the online courses where I could juggle and manage everything, I'm not so sure I would have been able to do it.
Still with online, I mean, that's super impressive to have children, to be working, to be doing all that. So that's
Yes. Yeah.
amazing.
Yeah. Thank you.
Okay, so why is it important for nurses now to now have a bachelor's and a master's degree?
I actually have this conversation a lot with some of my coworkers in PACU because they're all going back and getting them, and they're like, "Why?" And I said, there really is a difference. There's a difference in the knowledge that you have and the knowledge that you gain from having a diploma or an ADN to starting with your bachelor's. So with getting that bachelor's, you're given the skills to be able to lead others. That's one of the biggest things. And then you're also given the skills to be able to know where to go to get evidence to support what you're saying needs to change in nursing. And you're gaining that bigger picture of understanding about healthcare and the reasoning behind decisions being made. So that gives you that leadership ability and that foundational knowledge to be able to get evidence and provide support for everything you're saying. And then that master's degree, it allows you to specialize in whatever your passion is. So once you find that specialty you want with that master's degree and you're pursuing it, so many doors open up for you to continue to focus on what drives you. So you can become a nurse practitioner. You can get into population health. You can get into leadership, education, of course, quality and safety, along with a ton of other areas that you can get into.
So with all that being said, what would you tell someone who asked if earning a nursing degree was worth it?
100%. Absolutely. I have coworkers in PACU who are, well, I'm going to give an example. I have one who she is one of my fellow students. I work with her now, and she never went back because I was in a pre-licensure diploma program teaching. She never went back and got her ADN. And PACU has now opened up a educator position, and she would be wonderful for the position, but she doesn't have her bachelor's. And she's like, I don't want to go back. And I'm like, but by getting your bachelor's, you are going to open up so much for yourself to be able to do what you want, because this is where she wants to go and what she wants to do. And just by going back and spending that year and a half working on getting that bachelor's degree, she'll be able to work towards what she's wanting to achieve. So absolutely, it's worth it.
Why is an online learning environment often a good fit for a nurse seeking a bachelor's or master's degree in nursing?
I like to think that my story is a perfect example of it.
Yes.
But it allows you to juggle it all and to be able to do it all. A lot of times nurses are hesitant to go back to school because pre-licensure schooling is so hard. I mean, it is a hard journey mentally, physically, everything else. And they don't want to sit in a classroom, for 8 hours a day again, having to listen to somebody talk to them. So through that online, especially with our programs, we allow you to take that experience and that knowledge that you already have in nursing and apply it into the assignments that you have and what you are learning. So we want, a nurse who is already in a leadership position to be able to take her knowledge and apply it to what we have in the classroom and saying, okay, what new information can you gain from this assignment? So I think I kind of went around in circles with that, but yes.
No, that was a great answer. And it actually, it leads into my next question because, in 2024, there's a lot of online programs out there, but what's unique about the nursing degree program at SNHU compared to other schools?
So I think the most exciting thing is that both of our programs have just updated all of our curriculum and all of our courses to really reflect what's going on now and where nursing is going in the future. So with our program specifically, we want you to bring your experience, your knowledge, from life, not just work, and bring it into the classroom and apply it to what we are teaching you. And we want you to take whatever you just learned that one day and actually apply it the next day in your life or in your practice. We don't want you to wait 2 years and then be like, oh yeah, I learned that. We want you to apply it the next day. I'm fortunate enough for some of my students at SNHU, I see it happening. I teach evidence-based practice, which not many people like when they're getting into it, but I see many of the students come in and they identify a problem that they're having in their work. And through the course, they're finding solutions. And some of them are like, yeah, I'm taking it to my manager or my boss, and we're actually making a change in our practice. And that's what we want. We want our nurses to be leaders and to stand up and to make a change. So that's what makes SNHU special.
Yeah, I think that's great. I mean, the biggest value you can get is taking what you learn in the classroom and applying it to your real life job.
Absolutely.
Do you see that because it's people from around the country in an online program that people can bring unique perspectives to the program depending on where they live?
Oh, absolutely. I mean, just from geographical areas, you have people who might be living in a rural area. I didn't realize how much, the northeast area had some rural spots until I started talking to some of my students. I was like, oh, you don't have access like right there in the city for some things.
Especially New Hampshire.
Yeah. And that brings a whole new perspective into your experience. So not only do you have nurses and nurses alone, just because of our span of what we can do, you have that wide range of experience and knowledge and life experiences. And then when you get people from California or Wisconsin coming in, it's wonderful, especially when, we do put people in groups so they're talking to each other and bringing that experience in. And healthcare is not all the same. We have people who are in the top hospitals versus people who are in hospitals in rural communities, and the care that they're being able to provide to others are not the same. So we get to help each other and find solutions.
So when it comes to who is teaching these classes, who oversees and teaches in SNHU's online nursing degree programs?
Well, first and foremost, we're all nurses. Every single last one of us are nurses, and we have a wide range of experience, either in different areas, different specialties, different positions. And I think that's the biggest thing, is that you're bringing all of that to our program development. Our programs are developed by nurses. So of course we're all nurses. And then with our full-time faculty, the majority of all of us, all have terminal degrees, either, doctorates or PhDs or education degrees. And then our adjunct faculty, a lot of them have it also, and we're trying to get all of our faculty, full-time faculty, to also have their certified nurse educator certificate also. So
that's great. And we've kind of covered this throughout the episode, but what role does a nursing student's own professional experience play in their academic studies?
Everything. I don't think you can pursue a degree in nursing, or a bachelor's or a master's degree in nursing, without bringing your experience in. Or if you're in a program that does exclude your experience, I would consider a different program.
Maybe that's why it's so valuable too. SNHU, like we said, it's people from around the country.
Yes,
So many
yes,
different personal experiences here.
absolutely.
Um, so can you tell me a bit about our nursing students and what stands out to you about them?
I think the biggest thing that I enjoy is the diversity in them. In my most recent course, I have a student who she just graduated nursing school and she hasn't even begun working yet. And then I have another nurse who, she was talking to me. We had a phone conversation and she was saying that it's been 18 years since she was in school. And so I think that's very unique with our programs is it's not just um, younger generations or new students coming in. We have that broad with that diversity coming in, and we promote that diversity within our communication and within our assignments and everything else we do. I think that's our biggest push is just allowing it and wanting people to bring that diverse experience forward. Diversity and experience and also in who they are. Um, it's life, and let's accept it and embrace it.
So I'm going to switch gears here and talk about Nurses Week a little bit. This year's theme for National Nurses Week is You Make a Difference. How do nurses make a difference every day in healthcare?
I think nurses make a difference every day, and it's not just in healthcare. I think, and you've probably experienced this with your background of having nurses in your family, is that once you tell somebody you're a nurse, that's it. You're going to make a difference with them either through the conversation you're having, because it's guaranteed they're probably going to ask you a medical question.
Oh, yeah.
Yes. and the amazing thing is by saying you're a nurse, it doesn't matter where you work or what your background is. It's kind of thought that you know everything. You know as much as the doctors, sometimes more than the doctors.
Oh, yeah.
And so I think that as a nurse, once you become a nurse, through our conversations with others, through working, we are sharing our knowledge, we're supporting others, we're educating all the time, or we're just caring. And that's how we're making a difference every day, is just by being a nurse.
So if you could say one thing to all the nurses out there, no pressure, what message would you share?
Find your passion. You entered nursing for some reason. I couldn't necessarily say a specific reason. I just knew I wanted to be a nurse, but you find your passion. And then you're going to have to just pursue it. And that pursuing probably is going to require you to go back to school. But go ahead. And I always tell people, duck your head and do it. Get into school, find out where you want to go and where you want to make a difference, and just do it.
So now we're going to switch to the frequently asked questions about RN to BSN.
Okay.
And are SNHU's nursing programs accredited?
Oh, yes, absolutely. We are actually accredited by CCNE.
How long does it take to go from RN to BSN?
About 1.5 to 2 years and you can set that pace depending on how many classes that you need to take.
And what are some potential career outcomes for this program?
Well, as I've said, it's, you can get into management. You can begin pursuing some areas of education within hospital facilities. Just by having your bachelor's, it's going to open up so many doors for you. IT, quality improvement. If you like research, which not many people do, you can start doing research. It really is the foundation for opening those doors for you. I always like to say, well, what do you want to do? And they're like, such and such. And I'm like, okay, well, let's start by getting your bachelor's. There's your perfect spot.
What will someone learn from taking this program?
Okay, so with the BSN program, you're going to get that foundation of leadership skills. You're going to get So we do have a clinical judgment course, which is kind of like a health assessment course, and you're going to learn how to develop your clinical judgment skills, not just your assessment skills. So you're going to learn how to incorporate people's social determinants of health and health literacy and everything like that to really make a difference in an individual's caring for themselves. You're going to learn about quality improvement, not only how to identify areas where quality improvement needs to be made, but you're also going to identify how to initiate that change and be the leader of that change. I think one of the great things about our program is that we don't only want you to look at it at a local level. We do encourage you to see like the national and global impact you can have by looking at areas of change within your one local healthcare or within your local community. We then say, okay, so you're going to make a change here at this level. How is that going to impact things on a global level? And that's like a big concept to realize that a small change can have such a larger impact.
Why should someone choose SNHU for this program?
So again, it goes back to, I think our biggest thing is we want you to bring your knowledge and your experience to our program and to our classroom. And even if you're just entering nursing, let's say you just got your licensure, you still have knowledge and experience. Like you just spent, 2 years in nursing school, you have knowledge and experience. Let's bring it forward and let's apply it to the information. So that way you can go into the community the next day and help somebody else. Like I've already said, nurses are continually helping people just by saying I'm a nurse, because they're always wanting more from you or more information. And so those interactions, we want you to start applying what you're learning here the next day, the next, hour after you get off the computer because you just finished your assignment. Be like, oh, wait a minute, I just learned this.
Well, that was all the questions I had. So just thank you so much for joining us. And it was great talking to you. I obviously have so much respect for nurses. So this is a great conversation for me personally.
Thank you.
And thank you.
Well, thank you all.
Thank you.
All right. Have a good one.